My Lady, I appear on behalf of Long COVID Kids and Long COVID Kids Scotland, assisted by Miss Ienger and instructed by Jane Ryan of Bhatt Murphy Solicitors. Our clients embarked on Module 8 wanting answers to why their children are unwell, why so little was done to help them, and why, even now, the most basic steps have not been taken. The answers to those questions, to the extent they have been provided to the inquiry, are shameful. Even after the evidence of paediatric long COVID was brought to their attention, no one in government took the necessary steps to protect children from developing long COVID. To the contrary, the existence of paediatric long COVID was ignored or minimised. Even now, 5 years since the onset of the pandemic, wholly inadequate steps have been taken to assist children who develop long COVID. Those failures constitute an ongoing breach of the government's duty to place the best interests of children at the heart of their decision-making and to respect the human rights of those children and their families. My Lady, we intend to provide written closing submissions that identify the findings of fact and the recommendations we invite the inquiry to make. For now, we focus on the following 4 points. First, the ongoing impact of long COVID on our clients and their families. This is not controversial. Indeed, the inquiry has heard numerous accounts that have consistent and depressingly familiar themes. Our clients' children did not bounce back after their COVID infection or reinfection. Rather, COVID infection led to PIMS or developed into long COVID, leading to serious physical ill health and disability. Long COVID has damaged children's educational attendance and attainment, in some cases irreparably. Children with long COVID are often unable to enjoy the ordinary activities of childhood. Their parents have become their full-time carers. I turn second to outline some of the failures I referred to at the outset of these submissions. At no point during the relevant period or since has any governmental body warned parents, children or schools about the existence of and risks of long COVID. This silence from the then Prime Minister, from the Office of the Chief Medical Officers, from Public Health England and from the Department for Education constitutes a public health failure. Most notably, but not just, in summer 2021, when ministers received advice on several occasions that cases of long COVID in children would rise rapidly when restrictions were lifted, but accepted this as a strategic risk. A number of the Module 8 witnesses were asked why no public health advice has been given. All gave thoroughly unsatisfactory answers. I start with the then Prime Minister, Boris Johnson, who failed to refer to paediatric long COVID in press conferences or public statements in the relevant period, or indeed in his witness statement for Module 8. In his evidence to the inquiry, he accepted that if the government had advice about the particular risks of long COVID in children, I interposed to note that by summer 2021 he most certainly did, then the government should have warned parents. Mr Johnson offered no explanation for the government's failure to do so. Rather, in evidence that had echoes of the pervasive dismissal of long COVID in children, Mr Johnson made the bizarre suggestion that the 4 references to long COVID in children in the high prevalence paper of the 7th of July 2021 were typographical errors meant to refer to adults. The Chief Medical Officer, Professor Whitty, when asked about the consensus statement issued in August 2020, said that if the CMOs had known at the time what they did 9 months later, they would have included information about long COVID, as that would have been an important and accurate point to add. When asked subsequently why no statement was put out 9 months later in the summer of 2021, Professor Whitty said that there was no need, as long COVID had been discussed in the media, discussed in other fora, and that most parents would know it exists. This is, we say, an obviously unsatisfactory response. Parents should not have to piece together information about a serious and novel paediatric disease from various places. They deserve accurate public health advice from a reliable government source. Similarly, at no point has the Department for Education promulgated guidance for schools on long COVID, despite initially deciding to do so in the summer of 2021, a change in position that has not been fully explained. Ms Ackland Hood stated that the DfE do not ordinarily provide guidance to schools on health conditions, but we say the ordinary approach is wholly inadequate in the face of a novel paediatric condition that suddenly, in the space of months, affected the educational attendance and attainment of thousands of children. The former Secretary of State for Education, Sir Gavin Williamson, appeared to suggest that no advice was provided at the time, as it was not possible to give accurate information. He did not explain why it would not have been accurate to share with schools and parents the detailed advice provided to him by DfE officials on the 11th of May 2021. Professor Weiner, the chief scientific advisor to DfE, confirmed to Ms Dobbin that he agreed with the conclusions of the long COVID expert report that sets out both the prevalence and impact of long COVID. He accepted in his oral evidence that he had not provided advice to DfE on long COVID. Acknowledgement of this omission was, in my submission, reluctantly given, was unexplained and is, on any view, irrational. My clients now know that at the same time as deciding not to issue guidance to schools, the DfE was referring to material promulgated by long COVID kids for parents and schools as misinformation. This allegation is unexplained, as well as being unfair and untrue. It should never have been left to patient advocates to fill the information gap. And when long COVID kids did so, desperate at the lack of information available, they now know they were being maligned by the very organisation which had failed in its duty to provide guidance to schools. In her evidence, Ms McFarlane stated that we had tried so hard to raise awareness and get people to listen. And when I read that, it made me realise that we never stood a chance of getting the truth out because they didn't want it to be out. The misinformation was hiding the facts from families. The government's approach is reflected in the evidence of Professor Turner, Professor of the Royal College of Paediatrics and Child Health. He did not once refer to long COVID in his oral evidence, and indeed, in our submission, his evidence was unnuanced and cavalier, dismissive of the physical harm to children caused by the virus, describing it as having bounced off children. We say RCPCH failed, along with the OCOMO and PHE, to offer any acknowledgement, let alone leadership, on paediatric long COVID. The College appears to have taken no steps whatsoever to ensure children are correctly diagnosed with long COVID or that they receive appropriate health care. This collective failure to warn about the potential physical harm to children had real-world consequences. It is simply wrong to say, as Professor Whitty did, that a warning would have made no difference to the way people behaved. Quite apart from being entitled to accurate public health information, parents would have been able to make an informed risk assessment, including, for example, about vaccination. The silence contributed to the ongoing lack of knowledge amongst healthcare providers and a consequential failure to diagnose long COVID and to provide support. Schools continue to put in place reasonable adjustments such as flexible and hybrid learning, steps which the inquiry's expert, Professor McCluskey, has described as fair, reasonable and necessary. Third, my lady, why was there such total inaction? No satisfactory answer has been given to the inquiry. Doing the best that we can, it appears that overwhelming weight was placed on reassuring parents that schools were safe for children, to the exclusion of identifying the real risk of physical harm. The likely rise in cases of long COVID amongst children and young people following the removal of COVID restrictions was accepted as a strategic risk by, for example, Cabinet Office and the Scottish Government. But this was not an inevitable or a necessary trade-off. There could and should have been an approach to reopening schools that maximised their safety through the effective use of MPIs, proper ventilation and public health messaging. Instead, decision-makers in all four governments knowingly left children and their families uninformed and unprotected from the real risk of developing long COVID, and indeed for those children who already had long COVID, of reinfection. My clients emphasise that long COVID remains a roulette. Any child infected by SARS-CoV-2 can develop it. Fourth and finally, in the face of all of those failures, where are we now? The current and shameful position is that measures in place either to minimise the risk of children developing long COVID in the first place or to help those children who have long COVID are non-existent or obviously inadequate. There is still no public health messaging on the risk of long COVID for children and young people from any of the governments of the four nations. There remains no specific guidance to schools on how to support children with long COVID to access education safely. Despite Professor Noakes' evidence that ventilation and air cleaners are effective in schools for reducing the transmission of COVID as well as other respiratory viruses, the government fails to prioritise clean air for schools. There is no ongoing data collection on long COVID in children, either in terms of national prevalence or school absences due to long COVID. Long COVID's impact on educational attendance and attainment is therefore neither understood nor being responded to. Healthcare for children and young people with long COVID remains hopelessly inadequate. There were no dedicated long COVID services for children and young people in Scotland, Wales or Northern Ireland during the relevant period. Many specialist services in England have been closed and several more are closing. children and their families are still forced to seek expensive private healthcare. As a result, the burden remains on the families of profoundly ill children to seek the necessary change. In conclusion, my lady, we express our sincere thanks to the inquiry legal team for their considerable assistance in this module, and to the inquiry staff more broadly for the very smooth conduct of the hearings. My clients look forward to assisting the inquiry further in due course by the provision of their written closing submission.